Hello students. So today we'll start with information seeking strategies in public health. It is said that of all the sciences, public health has the most diversity, which is true. In what all does it have the diversity? It has diversity in its subject matter, its audience, its workforce, and therefore its information needs. So today we will learn about what is the value of information in public health, यानी लोक स्वास्थ्य में जानकारी की क्या महत्ता है. We will also identify challenges in using information professionally. What do we mean by professional use of information? What are the challenges? For example, information overload, information literacy, bias in the literature, as well as the multidisciplinary nature of public health. We will also learn to distinguish between the levels of information sources, that is, primary, secondary, and tertiary, and the resources available to obtain the appropriate information. Then we will learn how to locate and critically appraise the literature, especially the non-scholarly sources. And then we will construct internet and databases searches. I will teach you how to construct internet and database searches. That is how to go about selecting a database, what are the steps that should be utilized in doing a database search, and in the end, effectively conducting an internet research or a search. So we'll start with an overview of the topic. So today we'll learn the importance of information seeking strategies, both for a public health student as well as a public health practitioner. So information is everywhere. जानकारी हर जगह है, ये हम सब जानते हैं. हर वक्त निरंतर हम जानकारी में डूबे हुए हैं. कहाँ से मिलती है आपको ये जानकारी? न्यूज़पेपर्स से, अखबार से, मैगजीन से, यानी पत्रिकाओं से, और किताबों से. ये तो हुई पढ़ने की के द्वारा जो आप जानकारी प्राप्त कर सकते हैं, यानी पढ़ाई के द्वारा जो पढ़ सकते हैं. दूसरे आपको जानकारी के स्रोत जो रोजमर्रा के जीवन में होते हैं वो है एडवर्टाइजमेंट्स ऑन रेडियो एंड टेलीविजन. तो रेडियो और टीवी पर हम बहुत सारे विज्ञापनों के संपर्क में आते हैं जो हमें जानकारी देते हैं, और हम बातों के द्वारा भी, एक दूसरे से बातों के द्वारा भी जानकारी प्राप्त करते हैं. तो एक रोजमर्रा के जीवन में, एक दैनिक जीवन में हम बहुत सारी जानकारी से गुजरते हैं. हमारा मस्तिष्क बहुत सारी जानकारी प्राप्त करता है. Consequently, यानी नतीजतन, the professional public health practitioner needs to cultivate the appropriate skills. What are those appropriate skills? Those appropriate skills deal with finding and assessing information, यानी जानकारी प्राप्त करना और उसे assess करना. Assess करने का मतलब है उसका विश्लेषण करना, उस जानकारी का. क्यों करना है ये आपको? Because it is an attribute of efficient, high quality practice. यानी ये प्रभावी, उच्च स्तर की पब्लिक हेल्थ प्रैक्टिस के लिए ये जरूरी है. अब इसमें हम थियोरेटिकल और प्रैक्टिकल इंफॉर्मेशन दोनों सीखेंगे आज. अब क्योंकि कॉन्टेक्स्ट यानी संदर्भ किसी भी चीज को समझने में सहायता करता है, इसलिए हम पहले संदर्भ समझ लेंगे. उस संदर्भ में क्या आएगा? इंफॉर्मेशन ऑर्गेनाइजेशन के जो सिस्टम्स, व्हाट आर द सिस्टम्स ऑफ इंफॉर्मेशन ऑर्गेनाइजेशन. इंफॉर्मेशन को ऑर्गेनाइज कैसे किया जाता है, या किस ऑर्गेनाइज्ड फॉर्म में हमें जानकारी मिलती है. एंड सेकंड, हाउ इंफॉर्मेशन इज क्रिएटेड, यानी ये जानकारी उत्पन्न कैसे होती है, इसे क्रिएट कैसे किया. इसके अलावा हम ये समझेंगे कि डेटाबेस सिलेक्शन कैसे किया जाता है. हाउ डू यू चूज द करेक्ट डेटाबेस टू फाइंड इंफॉर्मेशन दैट एड्रेसेस योर क्वेश्चन. यानी सही डेटाबेस तक हम कैसे पहुंचे. अगर हमें किसी विषय पर जानकारी प्राप्त करनी है तो हम सही डेटाबेस कैसे चूज करें. दूसरा सवाल ये है, विल वन डेटाबेस प्रोवाइड द इंफॉर्मेशन और विल यू हैव टू यूज सेवरल. यानी एक ही डेटाबेस से हमें पर्याप्त जानकारी, सही जानकारी मिल जाएगी, या हमें एक से अधिक डेटाबेस, कई डेटाबेस यूज करने होंगे। अब इसमें जो प्रैक्टिकल एडवाइस, जो डेटाबेस सिलेक्शन पर दी जाएगी, वो एक कंपोनेंट है आज की क्लास का। यानी हम ये समझेंगे कि डेटाबेस सिलेक्शन, बहुत सारे डेटाबेसेस में से हम सही डेटाबेस कैसे सिलेक्ट करें अपने काम को, जिस विषय के लिए हमें जानकारी प्राप्त करनी है उसके लिए सही डेटाबेस क्या है। और एक बार हमने डेटाबेस चूज कर लिया कि हमें ये डेटाबेस या ये इन डेटाबेसेस में सर्च करना है, तो हम इफेक्टिवली उन डेटाबेसेस को कैसे सर्च करें, हाउ टू इफेक्टिवली सर्च डेटाबेसेस and how to effectively use search engines, that we will learn today. Now, what do we mean by professional use of information? We want to make a professional use of information. Layman भी information use करते हैं। जब हमने शुरुआत में ये बोला that of all the sciences, public health has the most diversity, as it has diversity in its subject matter. आप अपना first semester का syllabus खोल कर बैठेंगे तो आपको diversity in its subject matter समझ में आ जाएगा। ऑडियंस, डाइवर्सिटी इन इट्स ऑडियंस, आप अपनी क्लास में ही लोगों के बैकग्राउंड अगर चेक करेंगे, जितने वेरिड और डाइवर्स बैकग्राउंड से स्टूडेंट्स आते हैं पब्लिक हेल्थ पढ़ने के लिए, तो आपको उसकी ऑडियंस में डाइवर्सिटी समझ में आ जाएगी। डाइवर्सिटी इन इट्स वर्कफोर्स, यानी आप किसी भी पब्लिक हेल्थ ऑर्गेनाइजेशन, वेदर इट इज गवर्नमेंटल, नॉन गवर्नमेंटल, प्रॉफिट, नॉन प्रॉफिट ऑर्गेनाइजेशन, अ कंपनी, or any kind of organization, if you tend to visit any such organization, you will come across a hierarchy of workforce. So public health workforce is not a structured, leveled workforce. You have varied, diverse kind of work, and therefore there is a lot of diversity in its workforce. And all this diversity in turn creates a need for information. So you have to cater to all this, the diversity in its subject matter, the diversity in its audience, and the diversity in its workforce. And to cater to all this diversity, you need information. So therefore, the information needs of public health are vast. We know now, once we have acknowledged that the information needs of public health are vast as compared to any other subject or any other science, we are now clear with it that information is important for public health. But how will you go about searching that information? Where will you find that information? So are you thinking about Google or Wikipedia? Yes or no? Well, if yes, then you're not alone. Most of us, especially laymen, think once asked to search for an information, think about Googling or going to Wikipedia to find information on that keyword or topic. Now, we know that there is information on the internet. यानी इंटरनेट पर जानकारी है, available. And yes, lots of people know how to access that information. बहुत से लोगों को ये भी जानकारी है कि उस जानकारी तक पहुंचें कैसे, how to access that information. Unfortunately, for academic and professional work that you would need to do in future, as soon as you enter second semester, you would need to start preparing for your summer internship. And while you are doing your summer internship, you will need to be equipped with information seeking strategies in public health to do a good internship. And in the end, after you've completed your internship, you will need to prepare a good summer internship report. So all this would need information seeking skills or strategies. Unfortunately, for academic and professional work, Google and Wikipedia would not do. A search engine is not the right option for academic or professional work. So how do we go about academic or professional work? We know that search engines, Google is a search engine, for example, Bing is a search engine. So search engines such as Google, they search the free World Wide Web. What do we mean by free World Wide Web? World Wide Web. What is World Wide Web? First, let us understand what is World Wide Web. So World Wide Web is one of the avenues information is disseminated over the internet. It is a way of accessing information via the hypertext transfer protocol, that is HTTP, and it utilizes browsers to access web pages through hyperlinks. So for most part, www or the World Wide Web refers to web pages which are published by companies, organizations, and individuals. So anybody can publish on the free World Wide Web. In contrast, scholarly information is published in peer-reviewed journals. So what do we mean by peer review? Let's understand that as well. When we say peer review, it refers to a journal's policy of having experts in a given field examine a submitted article before accepting it for publication. So this process, what does this process ensure or assure? So this process assures that only high quality articles based on sound research that offer a significant contribution to the field are included for publication in the journal. So in simple terms, what does peer review mean? It refers to a journal's policy. यानी किसी journal की कोई नीति हो सकती है. Peer review policy demands that that journal would have a panel of experts or recognizes a panel of experts, and every time an article is submitted to that journal for publication, the journal is supposed to send that article to various experts in that subject or topic or area, and those experts would review that paper or article that is submitted for publication in that journal. And if they find that it is a high quality research article based on sound research, and it does offer significant contribution to the field or subject or area to which the article belongs, then only it would be accepted for publication in that particular journal. So this ensures that only high quality works are published in that journal. This is called as peer review. So scholarly articles are always published in, or scholarly information is always published in peer reviewed journals. Now, because most journal publishers, most journals are not free. So most journal publishers, they charge subscription fees to access their materials. So you will not find scholarly articles freely available on the web. Now, if scholarly articles are not freely available on the web, what does it mean? You will be able to access freely whatever is freely available on the World Wide Web, that is www. So if you only have access to the free information, how much of it can be used for professional or academic work? So an estimate has been made, and it says that only about 7% of what you might find on the free web, World Wide Web, is suitable for academic or professional work. The rest, 93%, is not suitable or apt for academic or professional work. Now, when only 7% of that information that is available freely on the web is useful for academic or professional work, how can one choose that 7% of useful information from or how can one differentiate that 7% of useful information, the information that is useful for academic or professional work, from the 93% of the junk information, not the junk information, but information that cannot be used for academic or professional. So you need to develop a skill to differentiate between the two. Now, there are many search engine marketing experts available on web, and there are companies that build themselves as search engine marketing experts. And many of them, I was searching for the data regarding the number of search engines and number of searches that are conducted every day, I came across MetaMend, the company, and it is a search engine marketing expert company, and it says that around 371 billion pages of content exists today on the web. So this Epler and Menges are two scientists, information scientists, who call this explosion of the number of web pages on the web as information overload. So Epler and Menges define information overload as a term. This I'm reading verbatim as they define information overload. They define information overload as a term often used to convey the simple notion of receiving too much information. So whenever anybody tends to feel that he or she is receiving too much information, or it is mind-boggling for our brain to process that information, that condition is defined as information overload. So how else would you feel inundated by information, right? So what could be some general examples of information overload? So first example could be an increase in the number of TV and cable channels that you come across every day. More than 800 channels exist today. There is an explosion of web pages. I just told you that around 371 billion pages of content exists on the web today. You type in any keyword or search topic on any search engine, you will come up with millions of results. So search engine results, they are the third example, they number in millions. Then the fourth is exposure to commercials and advertising. You come across so many commercials and advertising each day. Then there are piles of newspapers, magazines, and journals which are waiting to be read, which are never read, although. And one example could be daily intrusion of telecommunication. For example, your email, your cell phone, your personal digital assistants, that is PDAs, or instant messages. So all these are examples of information overload that you come across in your daily life. Now, there are negative consequences to information overload. What are those negative consequences? There could be a possible decrease in a person's ability to make good decisions. किसी व्यक्ति के अच्छे निर्णय लेने की क्षमता में किसी में आने वाली संभावित कमी को इंफॉर्मेशन ओवरलोड से होने वाली नेगेटिव कॉन्सिक्वेंस का नतीजा माना जाता है. Now, how is it manifested? How is this negative consequence of information overload manifested? This is manifested by a person's difficulty. यानी एक व्यक्ति की को कहाँ दिक्कत आती है? उसे दिक्कत आती है in identifying the relevant information. यानी सही जानकारी को पहचानने में दिक्कत आती है. ये पहली दिक्कत है. The second difficulty is becoming highly selective and ignoring a large amount of information. Let's say you've typed in a keyword on a search engine, say Google, public health. So today, if you type public health on Google, the Google search comes up with around 648 million results. So out of those 648 million results, which are the relevant ones for you? You're not going to read all the 648 million results. And the second difficulty is to become highly selective and ignore a large amount of information. How do you know which of these 648 million results is useful for you and which is not useful? Then the third difficulty is in identifying the relationship between details and the overall perspective. For example, let's take a topic. Which we've just covered, health policy. Right. So one has to understand, what do you mean by policy? What do you mean by health policy? Then what are the different types of health policies? What are the various theories? What are the determinants of health in a country or a region that determine health policies? So how are health policies made? Who makes health policies? So these are a bigger picture. Now, when you enter into a type of health policy, you would go into the intricate details of that particular type of health policy. So a person who is worked with information overload would not be able to identify the relationship between the details and the overall perspective when dealing with a subject or a topic. The fourth difficulty could be that that person might need more time to reach a decision than is necessary. यानी उसे किसी निर्णय तक पहुंचने में ज्यादा समय लग सकता है. और अंतिम दिक्कत जो वो व्यक्ति फेस कर सकता है, जो इंफॉर्मेशन ओवरलोड से जूझ रहा है, वो ये that after all this, after going through all this, that person might not be finally able to reach a decision of adequate accuracy. यानी एक सटीक निर्णय पर न पहुंच पाने की स्थिति. इस सब के बावजूद हो सकता है कि वो किसी सटीक निर्णय पर, सही निर्णय पर न पहुंच पाए वो व्यक्ति. तो ये सारी दिक्कतें इंफॉर्मेशन ओवरलोड से होने वाली नेगेटिव कॉन्सिक्वेंस. इंफॉर्मेशन ओवरलोड को इन्वर्टेड यू कर्व से डिपिक्ट किया जाता है. यानी इफ यू प्लॉट information load on the x-axis and decision accuracy on the y-axis, then the curve goes straight to a certain point. That means with every bit of information added, decision accuracy increases up to a certain point, then it reaches the peak, and then it becomes an inverted U curve, which means that beyond the point, if you keep on adding information, then it decreases the accuracy of a person's decision, and then it is termed as information overload. Now, in the professional literature for medicine and public health, this was about the general layman world. When you come to professional world of medicine and public health, information overload is a similar problem. उसके कुछ उदाहरण देख लेते हैं. Now we know that medical knowledge doubles every 6 to 8 years, with new medical procedures coming up every day. This is an example of information overload. How much can a person process? How much can a person process each day? When medical knowledge is doubling every 6 to 8 years and new medical procedures are coming up every day, how much can our mind process? The second example is because of the nature of the discipline of public health, because public health is both interdisciplinary and multidisciplinary. Interdisciplinary means that when you study health economics, you're not exactly studying health and you're not exactly studying economics. You are studying health economics. That is the economics of health. This is interdisciplinary. You need to be well versed in health. You need to be well versed in economics, but that's not enough. You need to understand economics of health or health in terms of economics. So health economics is an interdisciplinary topic. What do we mean? Public health is both interdisciplinary and multidisciplinary. What does multidisciplinary mean? Multidisciplinary means that you need to understand social sciences for studying public health. You need to understand environmental sciences if you want to be an expert in public health. You need to understand human biology. You need to understand economics. You need to understand policy. You need to understand management. This is multidisciplinary, that you need a combination of various subjects or sciences to be an expert in public health, as well as it is interdisciplinary, that is, you need a synthesis of various available branches of study to come up with new branches such as health economics. So this is interdisciplinary. Because public health is both interdisciplinary and multidisciplinary, the information volume and access again becomes a challenge. Because for studying health economics well, you need to be well versed in health, you need to be well versed in economics, and you also need to be well versed in health economics. That is economics of health. Third example is, I've already given you, that if you use public health as a keyword on the search engine Google today, it comes up with 648, more than 648 million results. A search on public health as a subject heading in Medline today gives you more than 5.5 million citations. Now, what is Medline? It is published by the National Library of Medicine, and the National Library of Medicine currently reports that Medline contains bibliographic citations and author abstracts from more than 7,000 biomedical journals, which are published in United States and hundreds of other countries. This database, the Medline database, contains more than 35 million citations, which date back to mid-1930s. Some of them do not have abstracts. The older ones, like the mid-1930s ones, do not have abstracts available, but still they come up with such citations. And these numbers, that is more than 35 million citations that the database has today, these numbers compound when you add other health databases such as CINAHL. So the full form of CINAHL is CINAHL. So the full form of CINAHL is Cumulative Index of Nursing and Allied Health Literature. This is another database. Then another biomedical or public health database, the biomedical or health or medicine or public health database is, besides Medline and CINAHL, PsycInfo, PSYCINFO, PsycInfo. When you include Medline plus CINAHL plus PsycInfo, the numbers compound. Medline alone comes up with more than 5.5 million citations. More than 35 million citations. And then when you add CINAHL and PsycInfo to it, the numbers compound, and compound even when you consider the overlap, that some papers or some citations would be overlapping in all the three databases. So this was to give you an overview of how to, what do we mean by information overload, and how to make professional use of information. What do we mean by professional use of information? So professional use of information requires information literacy, that a person needs to be information literate. There's a very famous saying by Gordon G. and Patricius N. Breivik in their book, Libraries and Learning, that in an era when today's truths become, this book was written in 1987. If this saying was true in 1987, it is truer today in 2021. The saying goes as, in an era when today's truths become tomorrow's outdated concepts, individuals who are unable to gather pertinent information are equally as illiterate as those who are unable to read or write. Which means that in today's era, आज के समय में जब आज की सच्चाई कल की, आने वाले कल की आउटडेटेड कॉन्सेप्ट बन जाती है, ऐसे समय में वो व्यक्ति जो पर्टिनेंट इंफॉर्मेशन, सही जानकारी नहीं रखते हैं, वो उनके जितने ही अनपढ़ हैं जिन्हें पढ़ना या लिखना नहीं आता। अब ये सेइंग आज के समय में 2021 में और ज्यादा सटीक बैठती है। See, the traditional measures of literacy are, as we all know, reading and writing, लिखना और पढ़ना। इसके अलावा, for today's graduates, it is essential to be computer literate as well as digital literate. So what do we mean by computer and digital literacy? Let's understand that first. So when we say computer literacy, it is a familiarity with computing concepts and the ability to use common applications on computer. When we say digital literacy, it means the productive use of the internet. As soon as you use the word digital, it deals with the productive use of the internet. So digital literacy means the productive use of the internet to present, access and use information. यानी अपनी जानकारी प्रस्तुत करना इंटरनेट के माध्यम से, प्रभावी रूप से उस जानकारी तक पहुंच बनाना और जानकारी का सही उपयोग करना, ये अगर आपको उपयोगी ढंग से करना आता है इंटरनेट पर, then you can be called digitally literate or digital literate. तो आज के समय में besides traditional literacy, that is reading and writing, the art of reading and writing, you also need to have computer literacy as well as digital literacy. Now, besides computer and digital literacy, if you want to be information literate, you need to have 3 practical skills. The first skill is you need to know how to select the right databases to search. The second is you need to know how to utilize the steps for a successful search. What are the steps for a successful search and how to utilize those steps to do a successful search. And the third step is conducting effective internet research. That is doing an effective research on internet. These 3 aspects also combine aspects of computer and digital literacy, because you won't be able to acquire these 3 skills without computer and digital literacy. So computer and digital literacy form the base for acquiring these skills. Now, these concepts put together, that is these skills plus computer and digital literacy, they provide you a broad understanding of what information literacy is. So when we say information literacy, what does it mean? It means a person's ability to effectively find and evaluate answers to questions using a variety of information sources. So information literacy is एक व्यक्ति की वो क्षमता जिसका उपयोग करके, यानी बहुत सारी जानकारी के स्रोतों का उपयोग करते हुए किसी सवाल के या सवालों के जवाब तक पहुंचे और उन जवाबों को इवैल्यूएट यानी उनका विश्लेषण करने में भी वो सक्षम है। इस एबिलिटी को इंफॉर्मेशन लिटरेसी कहते हैं। अगर हम इसको साइंटिफिक लैंग्वेज में आपको एक्सप्लेन करना चाहें, व्हाट डू वी मीन बाय इंफॉर्मेशन लिटरेसी? सो इंफॉर्मेशन लिटरेसी इज अ सेट ऑफ एबिलिटीज requiring individuals to recognize when information is needed, यानी जानकारी की कब आवश्यकता है, and have the ability to locate, evaluate and use effectively the needed information. यानी एक व्यक्ति की क्षमताओं का वो सेट, वो समुच्चय जो कि उस व्यक्ति को इस योग्य बनाता है कि वो ये पहचान सके कि उसे कब किस जानकारी की आवश्यकता है और उस जानकारी तक पहुंचने के लिए वो जानकारी उसे कहाँ प्राप्त होगी, उस जानकारी का जो जानकारी प्राप्त हुई उसका विश्लेषण करना आना चाहिए उस व्यक्ति को, और उसे इफेक्टिव यानी प्रभावी रूप से उस जानकारी का उपयोग करना आना चाहिए। यदि ये क्षमताएं किसी व्यक्ति में है तो वो इंफॉर्मेशन लिटरेट कहलाता है। That means that person possesses information literacy. फॉर एग्जाम्पल, हम एक उदाहरण से इसको समझाने की कोशिश करेंगे कि यदि ये बोला जाए आपको कि आपको बिल और मेलिंडा गेट्स फाउंडेशन में एक ग्रांट प्रपोजल सबमिट करना है, आपको एक ग्रांट लिखनी है और वो प्रपोजल सबमिट करना है बिल एंड मेलिंडा गेट्स फाउंडेशन के लिए ताकि वो आपकी ग्रांट मंजूर कर सके। इंफॉर्मेशन, अब इसमें 2 सिनेरियोस हम डिस्कस करेंगे। वन इन विच एन इंफॉर्मेशन इलिटरेट tries to write a grant proposal and submit it to Bill and Melinda Gates Foundation, and the second in which an information literate person does the same. So an information illiterate person will go to Google. He or she will find the Bill and Melinda Gates Foundation website and then would take at face value whatever the foundation has to say for itself. That is, what type of projects do we grant, and what types of projects should be submitted to Bill and Melinda Gates Foundation. So information illiterate person would simply Google Bill and Melinda Gates Foundation, go to the website and read what Bill and Melinda Gates Foundation has to say about itself, which is foolish. In contrast, the information literate person would access the library which is available online and would search a variety of databases. So how would the information literate person go about? So the path of the information literate person will go from business and management information. So why does a person who is writing a grant proposal for Bill and Melinda Gates Foundation need business and management information. He needs business and management information to read an unbiased company record. Why do you need an unbiased company record? You need an unbiased company record to find out what types of projects are funded by the foundation in reality. Because if you don't know that and you take at face value what Bill and Melinda Gates Foundation has to say about itself on its webpage, then you cannot be more stupid. So how to find out how to go about business and management information? You can go to Hoover's company records. They are available online. And there you can read an unbiased company record. That is what is the company, what is the real purpose of the company, that is Bill and Melinda Gates Foundation, and what all types of projects has been funded by the foundation in the past. This will help you frame your grant proposal well. Then the path of the information literate will go from business and management information. He has obtained this information. Then he would move to news sources and broad databases. What could be those broad databases? Such as ProQuest Research Library, LexisNexis Academic, or Scopus. So this would be his news source and broad databases: ProQuest Research Library, LexisNexis Academic, and Scopus. And finally, he would or she would move to research databases, pure research databases, which could be Global Health and Medline. So all this would help information literate person to assess the types of projects that are funded by the foundation and the kind of science that is generated from the research funded by the foundation. And this would give the person, the information literate person, the adequate, accurate information and background, which will help him or her to write a grant proposal that carries more chances of being accepted by the foundation for funding. Now, we will discuss about the term. Next, we will discuss about the term evidence-based medicine. Why are we discussing about evidence-based medicine? Because the information literacy skills that we just discussed about, that is selecting the right databases to search, utilizing the steps for a successful search, and conducting effective internet searches. These skills are important. Why are they important? They are important because they don't just enable a public health student or a practitioner to deal with information overload. Because if you know how to select the right database, your work is half done. Then the second step is how to go about doing a successful search using that database or databases. And the third is conducting effective internet research. So they help a student, public health student or a practitioner to deal with information overload, to differentiate between useless information and useful information. And if this is done right, then this is what is required for the successful evidence-based practice, which is a need of the hour. So what do we mean by evidence-based practice, or what do we mean by evidence-based medicine in the first place? Evidence-based medicine is a widely used term. You all must have come across it, but most of us do not understand what is evidence-based medicine. So evidence-based medicine is decision-making based on scientific reasoning and systematic use of data and information systems. यानी evidence-based medicine का मतलब है कि वो व्यक्ति जो evidence-based medicine practice कर रहा है, उसका decision-making process किन चीजों पर बेस्ड होगा, यानी उसकी निर्णय करने की क्षमता का जो आधार है वो किन चीजों पर आधारित होगा. वो आधारित होगा साइंटिफिक रीजनिंग पर, यानी वैज्ञानिक सोच पर, लॉजिक पर, और सिस्टमैटिक यूज ऑफ डेटा एंड इंफॉर्मेशन सिस्टम्स, यानी डेटा और इंफॉर्मेशन सिस्टम्स के सिस्टमैटिक यूज पर आधारित होगा. वो साइंटिफिक रीजनिंग यूज करेगा और डेटा और इंफॉर्मेशन सिस्टम्स का साइंटिफिक यूज करेगा किसी निर्णय पर पहुंचने के लिए. इसे हम एविडेंस बेस्ड मेडिसिन कहते हैं. इसे अगर हम साइंटिफिकली डिफाइन करना चाहें एविडेंस बेस्ड मेडिसिन को, तो एविडेंस बेस्ड मेडिसिन इज डिफाइंड एज द कंसेंसस, explicit and judicious use of current best evidence in making decisions about the care of individual patients. So which means that if you want to care about an individual patient, making use in making decisions, making use of the current best evidence, then it has to be conscientious. That decision making has to be conscientious, explicit and judicious. For example, इसका एक सटीक उदाहरण आपको आजकल के कोरोना वायरस वैक्सीनेशन के एग्जाम्पल से समझा देती हूँ. That government has rolled out the Covishield and Covaxin vaccines, which are vaccines against the COVID-19 in India. Now, whether a person should get vaccinated, a person who is above 65 years of age, whether a person who is immunocompromised, or a pregnant lady, or a breastfeeding mother, or suffering from certain diseases, whether that person should get vaccinated or not, this would be called as evidence-based medicine. If the person or the doctor or the caregiver comes to this decision whether this person should be vaccinated or not, based on the current best evidence, that is whatever is reported in the current literature as the vaccination process is undergoing, making use of that best evidence in deciding about whether a particular person should be given vaccination against COVID-19 or not, if the evidence is made use of in that, and the systematic use of data and information that is available on such vaccination, if that is made use of, then this would come as an example of evidence-based practice of evidence-based medicine. So evidence-based medicine specifically refers to the clinical environment, where a caregiver, a healthcare provider is dealing with an individual patient in a clinical environment. The practice of evidence-based the evidence-based practice has now expanded to other fields such as evidence-based public health, evidence-based nursing, evidence-based librarianship, evidence-based management, and so on. So what do we mean by evidence-based public health? Let's understand that. Evidence-based public health means that effectively finding and evaluating answers to questions about populations and disease or health. So if a person is interested in finding out answers to questions that deal with population and disease, or population and health, a specific population and disease and a specific population or health, if you have certain questions regarding that and you want to find answers, effectively find answers to that, and you want to evaluate those answers, then this practice is known as evidence-based public health. If you are using current best evidence as well as scientific reasoning, you are using scientific reasoning, current best evidence, and making systematic use of data and information that is available to you to find answers to questions dealing with population and health and population or disease, then this is known as evidence-based public health. Which means you are utilizing the current best evidence that is available to you in coming to a right decision. So when this is done right, that is the evidence-based practice, the evidence-based model is not any use of information. यानी आपको किसी भी जानकारी का उपयोग नहीं कर लेना है. It is the use of evaluated, reproducible evidence. That means an evidence that has been evaluated, जिसका आकलन किया जा चुका है, जिस evidence का यानी को peer-reviewed journals में या scholarly articles में जिसे publish किया गया है, जिस evidence को या at least reliable sources से हुआ है, और जो reproducible है, यानी दुनिया में कोई भी व्यक्ति उसे उस सेट ऑफ प्रैक्टिकल कंडीशंस को लेकर रिपीट करेगा तो समान रिजल्ट्स मिलेंगे, यानी एक ही तरीके के रिजल्ट्स मिलेंगे। तो इवैल्यूएटेड और रिप्रोड्यूसिबल एविडेंस के यूज को ही हम एविडेंस बेस्ड प्रैक्टिस मानते हैं। अब पिछले कुछ समय में पब्लिक हेल्थ प्रॉब्लम्स और उनसे निपटने के लिए जो अप्रोचेस अप्लाई की जा रही हैं, उनमें काफी टेक्निकल सोफिस्टिकेशन आ गई है। और इसलिए इस बात पर बल दिया जाने लगा है that one should use evidence-based approach to developing policy and interventions for dealing with such public health problems. यानी जो अवेलेबल एविडेंस है, आपके पास सबूत है, साक्ष्य है, जो आपको समाज में दिखते हैं या उस जनसंख्या में दिखते हैं, उनका उपयोग करके हम पब्लिक हेल्थ पॉलिसी और पब्लिक हेल्थ इंटरवेंशंस पर निर्णय करें। तो इनफैक्ट जितनी भी तरीके की पब्लिक हेल्थ प्रॉब्लम्स और अप्रोचेस हैं, उनको 10 essential public health services में कैटेगराइज किया गया है। So this was done by a steering committee which included representatives from the US public health service agencies and other major public health organizations. तो ऐसी 10 essential public health services recognized की गई है। All the 10 essential public health services have been broadly categorized into see, there are two major categories of services. One is the research is the core, and the second is system. All the other services deal with system management. So research is the core, and all the other services deal with system management of systems. So there are three broad categories of services. That is, first category is assessment of the problem. Then the second category is policy development, how to make policy, and the third category is assurance. That is, you assure the link to that service or provide care. So the three broad categories of services are assessment, policy development, and assurance. And each one of these categories and the subsequent interventions that are involved therein are all dependent on appropriate use of information. So all the 10 public health services are dependent on appropriate use of information. So if you want to give effective, essential public health services to the population, to the public, then you are dependent on appropriate use of information. You must have information seeking strategies as an expert public health student or practitioner. So therefore, the public health workforce has a critical need, especially critical need for such information seeking skills. So let's discuss what are those 10 essential public health services. The first one is to monitor health, which means monitor health status to identify and solve community health problems. Second is diagnose and investigate. That is, diagnose and investigate health problems and health hazards in the community. So first is you monitor the health status in a community and try to identify and solve community health problems. The second step is you diagnose and investigate health problems and health hazards in the community. Then the third is inform, educate, and empower. The third essential public health service is inform, educate, and empower. Inform, educate, and empower whom? Inform, educate, and empower people about health issues. The fourth is mobilize community partnerships. That is, you need to mobilize community partnerships and action to identify and solve health problems. The fifth essential public health service is develop policies. Develop policies for what? Develop policies and plans that support individual and community health efforts. Sixth is enforce laws. Now, enforce laws and regulations that protect health and ensure safety. Seventh deals with linking to or providing care. Linking to means linking people to needed personal health services and assuring the provision of healthcare when it is not available or when otherwise unavailable. Eighth is assure competent workforce. That is, assure competent healthcare as well as public health workforce. So assure competent public and personal healthcare workforce. Ninth is evaluate. Ninth, essential public health services, evaluate or evaluation. That is, evaluate effectiveness, accessibility, and quality of personal and population-based health services. Effectiveness, accessibility, and quality of personal and population-based health services. इसको एक एग्जांपल से आपको समझा देती हूँ. इफेक्टिवनेस का मतलब है कि वो हेल्थ सर्विस कितनी प्रभावी है. यानी अगर आप कोविड-19 के अगेंस्ट वैक्सीनेशन को एक सर्विस, पब्लिक हेल्थ सर्विस मानते हैं, तो वो वैक्सीनेशन सर्विस कितनी इफेक्टिव है, यानी कितनी प्रभावी है, जनसंख्या को कितनी सुरक्षा देती है कोविड-19 से. Accessibility is how much accessible or how easily accessible is that service to the population. So because we know that government is providing this service for free, and in private hospitals they are charging a minimal amount, insignificant amount for getting vaccinated. So this service is accessible to all in that population. We can say that it is easily accessible to the population at large. Quality of personnel, effectiveness, accessibility, and quality. Like, what is the quality of that service that is being given to the public or the population? So the quality is also good because the vaccine quality is good and it has been approved. It is a reliable vaccine. So now here we were evaluating the effectiveness, accessibility, and the quality of the vaccination service, of the vaccination service provided by the government of India or the private hospitals into Indian population. So you have to evaluate effectiveness, accessibility, and quality of personal and population-based health services in a similar manner. The 10th essential core public health service is research for new insights, which is the core of all the other system management services. Research for new insights and innovative solutions to health problems. That is, you have to get new insights through research, and you also have to find innovative solutions to existing health problems through research. Now, what all traits are needed to be a good public health worker or to develop the information seeking strategies in public health? So the first trait is being curious. The second is being persistent. The third is being analytical. And the fourth is being thoughtful. That is, a person should be curious, he or she should be persistent, analytical, and thoughtful. If you have all these four traits, then these are the four traits that are required for public health work, and they are also the traits needed in information seeking. So, what do we mean by curious? So, an inquisitive mind and an active desire to learn and to know are the attributes of a curious person. That is, a curious person has an inquisitive mind, he or she asks questions, and he or she also has an active desire to learn and to know. So if you have both these qualities, you are a curious person. Now, what do we mean by being persistent? We know that getting answers is not always straightforward. You cannot take all answers at face value because all answers might not always be true. So persistence means not taking answers at face value. Then what do you do with those answers? You question and appraise those answers. यानी आप जो जवाब आपको मिले हैं उन पर आप फिर से सवाल उठाएंगे और उनका आकलन करेंगे कि क्या ये जवाब सही है या नहीं. This is known as persistence. यानी आप ये जानने की कोशिश करेंगे कि what bias is there, exists in the literature, what bias exists in the literature, what bias is there in the society, and you will try and make every effort to use all the available resources at your hand, and that would make the difference between a novice and a professional. A professional would try to use all the available resources to get to verify the answer that he or she has got in return to a particular question, whereas a novice will take answers at face value without understanding what bias exists in literature or in society regarding a particular topic or a subject. Plus, if faced with difficulty, we know that in good libraries, there are reference librarians available to help. So you have to be curious, you have to be persistent, you have to be analytical, and you have to be thoughtful. You have to analyze your answer, and you have to keep thinking about it, about the verificacy of your answer, whether the answer is right or not. So every area of public health research, right from epidemiology to health policy, all these areas of public health research, they also report their findings and publish their articles in scholarly journals. So they report their findings and opinions in published literature. Now that literature, if you assume it to be one size fits all, that is, it is same for everyone, this is not true. The differences exist in that literature, and that difference can be explained in terms of one word, that is bias. So what is bias? So the Johns Hopkins Bloomberg School of Public Health defines bias as the amount we are off from the true value. यानी सही वैल्यू से हम जितना दूर हैं वो हमारा बायस है. जो सही मूल्य है, जो सही वैल्यू है, ट्रू वैल्यू है, उस ट्रू वैल्यू से हम जितना दूर हैं उतना हम बायस हैं. अगर हम कम दूर हैं तो हम कम बायस हैं. अगर हम एग्जैक्टली ट्रू वैल्यू पर हैं तो हम बायस नहीं हैं, और अगर हम उस ट्रू वैल्यू से ज्यादा दूर हैं तो हम ज्यादा बायस हैं. यानी आप कितने बायस्ड हैं ये जानने के लिए आप क्या सवाल पूछेंगे? हाउ रॉन्ग वी आर व्हेन वी डोंट गेट इट राइट. यानी जब हम सही नहीं हैं तो हम कितने गलत हैं. यानी अगर हम ट्रू वैल्यू पर नहीं खड़े हैं तो हम ट्रू वैल्यू से कितने दूर खड़े हैं, ये बताएगा कि हम कितने गलत हैं या कितने बायस्ड हैं. अब एपिडेमियोलॉजिकल स्टडी डिजाइंस और लिटरेचर रीडिंग के कॉन्टेक्स्ट में बायस को बहुत अच्छे से एक्सप्लेन किया गया है और लोग समझते भी हैं, क्योंकि उस पर बहुत सारी स्टडीज हुई है. टेक्स्ट बुक में उनकी डेफिनेशन दी हुई है. एपिडेमियोलॉजिकल स्टडीज डिजाइन करते वक्त बायस से हमारा क्या मतलब होता है, स्ट्रक्चरल बायस क्या होता है, या while literature reading, what all bias exists and what all care has to be taken to avoid that bias. But while performing searches, literature searches, and accessing literature, bias has not been defined well. So we still do not know the role of bias. While in the context of performing literature searches, that is when you are searching for information and accessing that literature or information. However, if a person has a simple understanding of when and how that information is produced, we can easily avoid this bias, or we can easily correct the situation even if the bias exists. So you only have to ask one question: when and how was this information created? For example, let's take example of this COVID-19 pandemic. So the COVID-19 pandemic occurred, or it could be another example like the tsunami of December 2004, or 26/11 or 9/11, any event, a catastrophic event. It need not be traumatic though. So let's take example of the COVID-19 pandemic. So it was an event, the pandemic spread to the entire world. And so when it did spread, or when the pandemic indeed began, information about the event is created and disseminated. So the information was created and disseminated about the pandemic. And with the passage of time, this passage of time is in relation to the event. That is, when the pandemic started, it started as an outbreak in China, in the Hunan city of Wuhan province of China. And with the passage of time, in relation to that event, when the information is produced, taking also into account the medium through which the information is disseminated, it will tell you a lot about the quality of the information. That is, what can you expect to find when you are closer to an event, and what can you expect to find when you are relatively far off from the event. So when closer to the event itself, that is when the pandemic had yet started, the information provided was simple: who, what, when. कौन, क्या, कब, यानी कितने लोग कोविड से पीड़ित हैं, किस देश में पीड़ित हैं, क्या सिम्टम्स हैं कोविड के, कैसे फैल रहा है, इंफॉर्मेशन प्रोवाइडेड सिंपली। टिपिकल सोर्सेस क्या थे इंफॉर्मेशन के, सोशल नेटवर्क्स थे, ब्लॉग्स थे, विकीज थे, न्यूज सोर्सेस थे, केबल न्यूज वेबसाइट्स थी, मैगजीन्स थी, और ये सारा वर्ल्ड वाइड वेब से पर अवेलेबल था या टीवी पर अवेलेबल था, और लोग जानकारी प्राप्त कर रहे थे कोविड-19 पैंडेमिक के बारे में। एज मोर टाइम पास्ट, जैसे जैसे समय बीता, the type of author changed from those with little or no expertise, जिनके पास ज्यादा एक्सपर्टीज नहीं थी या बिल्कुल ही नहीं थी, उससे चेंज होकर टाइप ऑफ ऑथर बन गया प्रोफेशनल या एक्सपर्ट या स्कॉलर। अब स्कॉलरली जर्नल्स में पीयर रिव्यूड आर्टिकल्स आने लगे कोविड-19 पर या कोरोना वायरस पर, प्रोफेशनल्स आर्टिकल्स लिखने लगे, एक्सपर्ट्स लिखने लगे, साइंटिस्ट लिखने लगे जो उस क्षेत्र में एक्सपर्ट्स हैं या प्रोफेशनल्स हैं, पब्लिक हेल्थ साइंटिस्ट लिखने लगे। बायस को और लिमिट किया गया through use of peer review, footnotes and bibliographies, that is references were given, how many citations a particular reference has undergone, that was mentioned. So what you find at the other end of the spectrum, that means when the event started and at a later time far off from the event, that is years after the event has occurred, true research now is being produced and disseminated on COVID-19. So when you are closer to an event, the information provided might have a lot of bias because the things are not yet clear. And information is given by people who are not experts in those fields, that is journalists or writers who may or may not have an expertise in the article's topic. But with passage of time, the type of author changes from journalists or writers who may or may not have expertise in the topic to practitioners or professionals, researchers, scholars, who are considered experts in their field. So the bias goes off with time. So the information timeline helps you decide how much or how less is the information biased or could be. The background of the author, the qualifications of the author, the authority of that author in a particular subject area, or the expertise of the author of that author also helps you decide how much bias exists in the literature provided by that author. So now we've already recorded how much. Now I'm cutting off this audio lecture here itself. So we'll meet again in the next class to learn about the various kinds of organization system of information organization systems exist, that is World Wide Web, Gray Literature, Medline database, and then we will also deal with case studies, and in the end we'll learn about how to search the literature, the steps involved in the bibliographic database searching, and how to go about successful internet research. So this is all for today. So I'm ending the class for today.